called a Rachel Pi. It's a fully loaded. It's my gosh, it's smaller than a laptop, and it's loaded with software from OER2Go, and all of it's basically from universities all around the world. They download it in the language of the country that you're going to be installing this. Solar powered. It connects to Chromebooks. Solar powered Chromebooks. A $1,250 donation for us anyway would do an entire school in Guatemala. Fred and his wife have put in a substantial amount of money, and we're going to do another one in Kenya. And those are our first two grants, but they will provide education in remote areas for children that would prior to this would have no access. So it's pretty exciting for us as a club. So what I'm going to do, John, I'm going to have you go ahead and get started. And if anyone else signs in, wonderful. If not, this will be recorded. And I always send an email out to the club. This gets recorded. I go to YouTube. Then I backload it onto the website, and then people can sign on. So, John, why don't you go ahead, introduce yourself, your background, and how it is that you're an expert in tonight's topic.
Okay. Well, great. Thanks for asking me to come. And those two projects sound really very interesting. It's just the power of small groups to make change.
Yep.
So I work at the Lewis Mason Thurston Area Agency on Aging. It's a long title. We were started by the Older Americans Act in 1965, and basically every county in the entire United States has an area agency on aging, which provides information to older adults. We have, we don't fund the senior centers anymore, but all the meals at the senior centers, that money comes through us. We do a lot of information. I print 10,000 to 12,000 little directories that are miniature phone books, basically, for services for older adults, as well as having 10,000 phone calls a year just between Lewis, Mason, and Thurston to help older adults or disabled adults find what they need to work in their home.
Wow. 10,000
The other
calls.
unique part of Washington that the area agency does, the other unique part of the area agencies is that in this state, we're very involved in Medicaid. If you were in the state like in Massachusetts that has an income tax, you would get very little service if you were older and disabled in your home. But when you got sick enough, you'd be in a very expensive nursing home. In this state, 20 years ago, they discovered we don't have the money to support that many older people in a skilled nursing home. So who's familiar, if you just raise your hand, with adult family homes? Have you heard of them? Good. They're like boarding care homes on the East Coast, 6 people or less. And we've invested in that heavily in the state. In fact, Thurston County has 180 of these adult family homes just in Thurston County that support people. Some of them specialize just for people with dementia, just with recovering from cancer, just for mental health or developmental disabilities. Very specialized care. And it's less than half the cost of skilled nursing. That's how the system has been able to sustain itself for the last 20 years and hopefully beyond that. So I got into this work when I was an undergrad. I started gerontology and then ended up getting my master's degree in counseling, both from the University of Notre Dame 30 years plus ago. And studied gerontology under some magnificent people, specialized in gerontology, chemical dependency, and trauma treatment through the years. And for the last 8.5, I've been with the area agency where it's been fun to be able to apply everything I've learned with these other fields to help basically caregivers do better caring for their family members. Most of the work that we do is with caregivers of people with a family member with dementia. Alzheimer's, dementia, the generic term. There's now 90 types of causes of dementia. Alzheimer's is probably the most famous one at this point, but it's a long illness. We're talking 8 to 15 years where symptoms can be there and they need care. Therefore, it defaults that that is our biggest population to help. So all my staff is really well versed in care techniques to help the caregiver deal with the often challenging behaviors that somebody with dementia can prevent as their memory gets less and less as their skills become less and less, and they frankly really need watching often 20 a day. In this state, there are over 25,000 just taking care of their family members, and many of them do it full time and have given up their jobs, retired early to take care of a parent or a spouse. And this is a huge expense for the area. So the topic for tonight was sort of, I saw that Bill put out, was the elder care issues in the future. And I would suggest that the future is now. You've probably heard about the silver tsunami, aging of America, and the graying of America. When I was in graduate school in the 80s, that was a very hot topic, and it just seemed so far off. But now it's really, it has been with us and is with us. But what we didn't know in the 1980s, we did not know the level of chronic illness that has occurred with all of us, and including our parents and spouses. Chronic illnesses like diabetes, heart disease, Parkinson's, and dementia. The models never predicted the amount of people who are going to be that sick and have, quote, chronic illnesses and need that kind of care. So the systems were never really prepared for this. Any questions so far? I also want to check if people can still hear me.
I can hear you.
Yep, we can hear you. Every once in a while,
Yeah.
something happens with the digital sound, but so far so good.
Okay. So along with the chronic illnesses, when you look at that much, there's also the level of and sophistication of medical care that back before EMS, which has saved a lot of people's lives, and before antibiotics, many older adults never died of a chronic illness. The most common cause of death up through the 1950s was actually pneumonia. People would get sick. In fact, I was just rereading part of George Washington's biography, and he was in very good health. And then one time he was out on a ride and got wet, and he got chilled, and he says, "Oh, I have a bad cold. I'm going to die." And a few days later, he did pass away. And that was actually a very common scenario 100 years ago, 50 years ago. So I won't do it here, but oftentimes when we do workshops, we say, who would be here if there was not modern medicine or an EMS, or they survived a heart attack because of the quality of the medicine? So that's where the aging population has grown, but they're also sicker than the aging population that was around in the 1920s and 30s. And in fact, when they set the Social Security age at 65, that was because Europe set the retirement age and the beneficiary age at 65. And the actuarials in Europe said 3% of the population lives to that age. So we can afford to do it. But now, guess what percentage now lives to 65? Most. What's the average age of men right now? Pardon me?
A lot more than in the past.
Yeah.
Oh, yeah. The average age was less than 65, and now for men, I forget, was it 76.8 to 79 years old? And women higher than that. So that's where we really weren't prepared. It's not a great topic, older adults. And that's where it is better than it used to be. At the turn of the century, in the 1900s, so many people outlived the family. The family moved out west and they were still east. Do you remember poorhouses? Yeah, there were actually poorhouses where people would go. And they looked like asylums where they fed you and you were really on your own. There wasn't a lot of care and there wasn't a lot of heating, and people also died there of pneumonia in great numbers. So our compassion and humanity has really grown with Medicare and Medicaid, where people can receive some services and live out their years with some care. So another issue that we're seeing is there are many more single households than there were 50 years ago. There are many more people living alone in their older years. Through divorce, through being more mobile, is that we have more people over 75 in an area where there's no relative within 250 miles. That's becoming more and more common. And it's harder to provide assistance. And there are many that report that they don't have anybody they can count on, especially in our work dealing with the people who have really have spent all the resources caring for themselves and are on Medicaid. There's also my notes here. Oh, so loneliness is a huge issue, and loneliness can, and lonely topic is only 30 years old of research. Loneliness feed into obviously depression. You're lonely, you can become depressed, and also you're depressed, you become lonely. Also, other illnesses are magnified where people experience profound loneliness, and that would be so depression and diabetes. It's actually a contributor. It's actually one of the antidotes or things that may prevent premature dementia is actually staying very socially connected, like being in Rotary, like participating in your community. Because not everybody who has the dementia, like the Alzheimer's gene, gets dementia. Everyone does. And some get it without that gene. So we know that lifestyle, and the current thinking is like the Mediterranean diet, can prevent the onset of an illness. And that's pretty significant because that's years, months and years of quality life and just less care needed, because dementia, if you have a family, it's really a family illness. Many people, the average person will have 2.3 caregivers, and often one of them will develop a chronic illness, helping a family member through their chronic illness, like dementia. It's a great toll on caregivers. So one of the things that we've been talking about to deal with that is staying socially connected, thinking about diet, think Mediterranean diet. That seems to be the current thinking among a lot of the physicians that I recommend. But also in general, we recommend people to think more like in a palliative approach to older adults, especially people with chronic illnesses. Are you guys familiar with palliative care? More people are familiar perhaps with hospice, end of life, the last 6 months of care of life. And there's distinct services and Medicaid for some of those. Before that is palliative or palliation, comfort care. So many families with somebody caring for a parent with dementia, they want to do their best for their person, give their best and do their best for their family member. But much is good enough. What is good enough? And palliative care is one way of framing that level of care. Is saying, I really want the comfort and safety for my mom. I'm going to do what I can for that. But I also have to worry about the comfort and safety and care for myself. Because one of the reasons why this whole family caregiver support program started, the federal government said there were some people who were caring for a spouse who ended up in a nursing home before the person they were caring for. And there are also spouses that were dying before the person that had dementia. That something has to be done. And actually, with the state of Washington, last April, we were named the #1 public long-term care system in the country. We finally beat out Minnesota. They're always known for being all perfect. So it's because of the supports like Family Caregiver. It's because of the use of adult family homes. And not just adult family homes. In this state are Medicaid, that is like social welfare, social support, when you've spent or had no resources. Just in Lewis, Mason, Thurston County, we support over 2,500 people to remain in their home. And so I have a group of social workers in our agency that will review their care, double check that the caregivers are coming from different contracted agencies, double checking that they're getting to their medical appointments. That's 2,500 people that if I said, like in Massachusetts, they would have gotten little care or they would in a skilled nursing. But these are people actually able to remain in their homes where, frankly, everybody would rather be. They'd rather be in their home sick rather than in a facility where they might not know anyone. So the palliation approach is something that we're trying to help caregivers see that they have a tremendous role of knowing what's good enough, how much can they give without harming themselves, and really daring to ask agencies like ours for more help if they're running out of energy. Oh, and the other thing that we have included and embraced in our agency is advanced care planning. Have you guys heard of advanced care planning? So like, it used to be called advanced directives. You know, you have a will,
Yeah.
and then what do I do? What do I do if I had a heart attack? What would I do if I was in a car accident and couldn't speak for myself? So these are advanced care plans.
Right.
I know locally, Providence has gotten a grant, and we've worked with them extensively. All my staff is trained in how to do those interviews. They're very detailed things, but I tell you, after you do one, there's a tremendous relief because you have the courage to kind of stare at death and actually contemplate for a moment, what do I want? You know, if I couldn't speak for myself, do I want to be intubated? Do I want artificial feeding? Do I want them to wait 3 days before they do something drastic and quote, pull the plug? Do I select a healthcare agent that's got the gumption to say, you know, John McBride's done. He said he didn't want these machines and stand up for me when I can't speak. So advanced care plans, you can see it on the web. And if you want, I can send Bill a bunch of links to these things.
Mm-hmm. Yeah, please.
We have tomorrow. Advanced care plans. There's a very good, the state of Washington, that pretty much all the hospitals in the state of Washington agree on. If you're a snowbird, you'll need one for Arizona. They don't take Washingtons. If you're working and traveling, have it with you. Have it with you. It may help. So, but advanced care plan also gets your mind around it. That thinking, there's a whole movement called death over dinner. And family members talk about your advanced care plan. Like, what if I die? What would you do? If I was dying, you know, could you help me play Mozart and just let me be? And so those are some ways of thinking that we're trying to approach in a very heartfelt way chronic illnesses in America. Because at some point you might not cure them, you're living with them. So how do we live best with them? How do we do quality of life? And how do we have the courage to peak at death? Like an advanced care plan? How do we kind of look at that? How do we communicate to our physicians about, you know, I don't want anything aggressive. I really would rather spend quality time not being nauseous with my family. This is what I'd like. And these are all conversations that are your right to have with your healthcare folk. So that's my little spiel of the future of aging now.
John, thank you. Let's have some questions, especially from Jim, because you come from a different perspective on the island. Do you have services like that for seniors on the island?
Pretty well, as far as I know. I've dealt with all this already, so I'm.
Mm-hmm. Which is why you're part of our club, right? We talked about that. Chuck, Chuck, go ahead.
I was a little bit confused at one point, John. I thought you were saying that the Washington plan had homes for people who are aging or suffering from dementia to go to. Sort of thought like a foster family that would take in multiple people. And then I thought at another point you were talking about providing care in the older person's own home. Is it both, or is it one or the other?
It is both. And thank you for clarifying. That's where Washington State has excelled. More options to be in your home if you can manage. And we'll realistically tell people that's a hard conversation. I'm really not sure I can bring enough care for you. It might be better. So the state, in your home, in the adult family homes, they're licensed, reviewed, assisted living, and the state does pay for skilled nursing. That's still part of that array of facility and home care. Does that make sense? Yep.
Go ahead, Deb.
I have a question. When you talk about you're involved in Medicaid, what does that look like? What does that mean when you say that? Do my Medicaid dollars go to you and you help me with that, or what does that look like?
Right. Medicaid dollars are all federal dollars, and they give portions to the states directly, and the states have to come up with a match. So if they give us $1 million, the state has to match with $1 million, but it allows the states, it gives them the freedom to say how we're going to spend it to care for our older citizens or disabled citizens. So the state, the division of DSHS, Health and Human Services, then they contract with a AAA. I guess it's kind of like AAAs are like school districts, you know, superintendent, and then they deal with small providers, or that would be like individual schools. And then the State Board of Education would be DSHS.
Okay.
Chuck, I was just thinking about, John, you talked about having the advanced care plan, but if you're a snowbird like Chuck is did you say it would not be in effect if he goes down and spends 6 months in Arizona, if it's written here in Washington?
Yeah, it would be best to get the Arizona form and have it with you.
Well,
So what if it was what if you did half the year in Hawaii? Same thing?
Same thing.
Okay.
Well, so that's easy to do. We can find out whether or not the Washington form would be necessary in Arizona. My wife was an estate planning lawyer before she retired, and but I can recommend, that's really a hard conversation to have. I talked to my wife and my 2 sons, and you get down to the details. At what point would you, we've seen relatives die, and through the agony of it. And, at what point would you want, we pulled the plug, take out the respirator, but, at what point do you want water and food withdrawn? And, have that conversation with your family. It's tough, but it's one you need to do.
It's really tough, I found, on your children, because my wife and I have several times sat down with this. Okay, it really is time to talk about this, and they don't want to talk about it.
I have a son.
Yeah, I'm getting ready to. Yeah, right. Yeah. I'm getting ready to embark on that conversation with my children because I have experienced that with both my parents.
Yeah.
And their healthcare directors were not clear. It was clear to me. I'm one of 5 children. Learned an awful lot about you need to designate that one child who is going to be the point of contact with their physician, number 1, and 2, make sure that your children know what it is you mean by no artificial supports.
Right.
So those are very tough conversations, but my husband and I are getting ready to have that conversation with our kids now.
I think it's really important too that we have 4 children, and they might all have different ideas.
You bet they do.
And one's going to say, if I'm in charge, I'm not pulling any plug. Or if the other one says, I'm going to have them feed you forever. So we're having that discussion. Well, we're trying to have that discussion. So the more children you have, it's harder in the mix because they all have different ideas about what they want to do for mom and dad. So,
absolutely. The worst thing you can do is not have one child designated, because whichever child is there when the doctor comes in, is that child is going to sign off on something that perhaps the other one might not. So
exactly.
The work you do, John, is extremely important.
Yeah, absolutely. John, I have a question for you. You were talking about the level of care people can get you have several people you take care of. At what point are they eligible? In other words, is this either be subsidized or is this income based? there must be an income level at which they become eligible for your services, right? Or right? What would that be?
Right. So for the Medicaid part, it's they're changing the rules a little bit. So here's the best big picture, that if you make less than $5,000 and somebody has a chronic illness, apply. It's online. You may get a no because you still have an annuity, but you'll know, and you can go to a financial planner to see what I do. Typically, though, it's people who, a married couple, less than $2,400 in retirement and assets under $50,000, but you can still have a home with $500,000 because of a lot of small farms and a car. They don't want to empower the surviving spouse. So we have some families that, they're taking care of mom and dad. They will apply for Medicare, and the dad, or Medicaid, the dad says, I want to be in my home. I just absolutely want to be in my home. We say, okay, and you're over assets by this amount. But if you're going to be in your home, Dad, you haven't fixed the roof in 20 years. Let's put a roof on. Save the receipt. You know that the water heater, I don't trust that. And you got rot. And let's fix this house so you can be there and it's warm. Save the receipt, because then all those expenses could help him have a better, comfortable home, and he'd be moving toward it. So working with a financial planner, getting some understanding of this. It's just a strange, Medicaid and Medicare are very strange worlds. Mm-hmm. Very small population of Medicaid. Retirement people have Medicare, and most of them don't know how to get on Medicare. You have to go to the Social Security office to get on Medicare. And that's like the secret no one knows about until they hit 65 and they got a friend. Because Medicare doesn't know you exist until Social Security office, and they have worked. So, it's a strange thing. You get a little older, then there's all these systems that you never heard of, and they have all their secret handshakes.
Other questions for John?
A lot of this is foreign to me, coming from Canada, because we have a totally different medical system. And I'm also a veteran, so I get a lot of things covered by Veterans Affairs. Do people down there get things like someone comes in and cleans your home, does your lawns, that sort of thing? You have that there?
The VA doesn't come and do your lawn.
No, we have that there, but we have to personally pay for that separate.
But I think maybe the question to John was, are services available to people so they can remain in their home? Do you, John, does your agency, or through your agency, whether it's washing the windows, patching the roof leak, maintaining the yard so it doesn't get away from them, are things like that available to people through you?
Yeah, if they're a client of ours on that Medicaid program, yes, we're bringing in help to maintain it. The sticky one is we're really not under the program supposed to care for their pet, and we're really not supposed to do the lawn, but that may change. They did a survey recently, and they discovered there are two big things that will send people to more expensive care. One of them is they got to maintain the lawn, because there's a lot of homeowners associations that insist on it.
Right.
So they're trying to discover that if they put a little money here and help, that people can stay in their home longer.
Right.
Right.
Where they want to be. Okay. So look, it may change when we retire.
Okay. So we're not quite there, Jim, but it sounds like we're working towards something like that.
My friends that I served with, they have their lawn care looked after, and they'll have people come in do their house cleaning for them as well.
Hmm.
And it certainly saves a lot of wear and tear on the veteran.
Oh, absolutely. Absolutely.
I think that's probably the
Yeah.
goal and objective is the welfare of the veterans.
Yeah, that's a good question. John, do you have any veteran preference programs, or is it just everyone who meets the financial need?
Could you say that again? I missed some of the.
Okay. Jim talked about, in Canada, they have programs for veterans. Within your administration, are there any like a veteran's preference, or do you get assistance from VA to help within your program?
Mhm. The VA has their own programs, and that has changed. One of the big ones is called Aid and Attendance, and it's basically if you're older, have less money, and need exactly that kind of help to manage in your home, and they will actually give you a certain amount of money so you can purchase whether it's lawn care or in-home care.
Okay.
Right now, in the last 6 years, it's gotten very hard to get because they never used to spend the money as of 8 years ago. It was this unknown benefit here, but because of so many younger soldiers have returned and are injured, they applied, and now the money's always being spent. And some older veterans are waiting longer to get on. So
I think perhaps part of it is in Canada, the armed forces, to be a member of the forces is volunteer. We're down in the States, it was mandatory. So you would have a huge veterans group, where in Canada, it's a fairly small veterans group that they would be looking after. So that may be one of the reasons why they don't have the funding available.
Makes a difference. That's right. Any other questions for John? I made a lot of notes, John. You used some terms that I haven't heard before, because my wife and I signed an advanced directive, but now it's called advanced care plan. So new terminology.
Yeah.
and some more choices in there.
Comfort care was new to me. Palliative
Yeah.
care
Oh, palliative. Yeah.
was new.
The one other little plug for the people in Thurston County is that if you do the advanced care plan on the Providence and you've ever been a patient there,
Mhm.
you go there and they'll put it in their electronic records.
Yep.
So when you
everybody
hit
has
the
that.
emergency room, it'll check off that you have one.
Mhm.
It'll highlight. And that might alert more people kind of your preference.
Mhm.
Mhm. Yeah, my wife and I did that. We got our plan through our lawyer, and the next time we had our annual physical, they actually asked us, "Did you have one of those?" So we actually went back and gave them one that they scanned into the records for us. So yeah.
Nice.
Yeah.
You're ahead of the game.
Yep. Well, I don't know about that, but I'm trying to keep up. Just trying to keep up. Any other questions for John? From anyone? Well, great. I wish we had more people in attendance, John, but like I told you, this will be, I'll edit it so we, get the stuff in the front and the stuff in the back out. But it will be, I'll send an email out to the club, let it know it's been recorded. It'll be on our website, and the members can, at their leisure, click on that and review it. I know my own son is a computer consultant. He's all over the place. And whenever he can, he'll sit down and go to the website and look at one of the programs. So that's pretty good. So
Very nice.
it does work. Okay. I think, given it's 1:45 already, and Deb, I know I had you on there, but I'd like to have more people before you do your member profile, if that's okay with you.
I'm good with that. That's fine.
Okay. Because I'd like to have about 10 or 12 people so that they can learn more about, because we're trying to do a member profile, John, once a month, where the club members get to meet each other via, this is who I am, where I've been, and why am I in Rotary. So I think what we'll do, unless anyone has anything for the good of the order.
I just want to make one suggestion. I put, my advanced directive on my computer files. So wherever I am, I can print one out.
That's a great idea.
Well, I never thought about that. That's a good idea. I should scan, my wife and I should do that. We travel a lot. We should scan ours and have it available from wherever we are. We can log into our home computer. That's a great idea, Chuck. Very good. Anything else for John tonight? I want to thank you so much, John. This was your second effort. We had a little trouble a couple months ago with the summer and everything. I do appreciate it very much. Actually, I took a lot of notes, so I learned a lot, and I know Deb did. I watched her take notes too.
Yeah. No, really, having gone through this with both my parents, researching adult care, researching skilled nursing, having paid for, nursing homes and knowing the care, quite frankly, it's not all that great. What you do is so important for the elderly and the disabled. So thank you so much for sharing.
Thank you.
Knowledge.
If you guys need help with an advanced care plan, you got my email. Give me a call. Yeah. I have people that can help.
You have people. And John, you said you were going to send us some links.
Yes. I'm going to send the advanced care plan documents, the state version and Providence version.
Right.
And was that it? Does anybody?
I think it was those two. Were there any other documents? I think it was those. But if you give them to me, I will send them out when I let everybody know that this meeting is recorded. I'll send those with that. And
excellent.
So they can have those to look at and then refer to this videotape.
That would be grand.
Great. Thank you so much, John.
Hey, thank you, guys.
Is there anything else for the good of the order? Because if not, we'll just end our meeting at this point. Anyone have anything for the good of the order?
No, thank you for sharing, Bill. We appreciate it.
Thank you, Chuck, Jim, John, Deb. Welcome aboard, Jim.
Thank you.
And I look forward to seeing you all at the next meeting.
All right. Thank you.
Okay. Everyone take care, okay?
You too.
Thank you, John.